Dr. Ashton here with us. She is taking a look at a few questions here, health and wellness questions. The first one here has to do with acid reflux. How do you manage acid reflux without relying on medication? Okay. Are there dietary steps?
There are dietary steps, and it involves eating smaller meals, not eating before bedtime when people typically have an exacerbation of this heartburn or reflux, avoiding known trigger foods or beverages, caffeine, alcohol, or sleeping on an incline. But I want to be crystal clear. If you have persistent heartburn, persistent GE reflux, it absolutely should be treated, because that exposure of acid to the esophagus can cause precancerous and eventually cancerous changes, a condition called Barrett's esophagus. So sometimes it's just a 2-week course of an over-the-counter medication to help with that heartburn, but this is not something that's just a little unpleasant. You should ignore it and go on. You should absolutely not ignore it, and if it's persistent, have it treated.
All right, next question. What are some ways to decrease bad cholesterol?
Well, we're talking about LDL, the lousy cholesterol. People oftentimes get confused about HDL, LDL. It has been clearly associated with increased risk of death, stroke, heart attack. Some of it is genetic, some of it is behavioral. So a diet low in saturated fat, a plant-based diet, believe it or not, even sometimes a keto diet, which is relatively low in carbohydrates, can improve those numbers in some people, which may be counterintuitive. Exercise definitely will improve it. However, just like the reflux question, I want to be clear, if your number is still elevated, the most meticulous attention to diet only will drop that number a maximum of about 20%. If it's still over 100, medication is warranted, it's indicated, it's safe and effective, and it has been shown to save lives. So we're talking largely statins here.
You tell us the decrease in fat. How much fat is supposed to be in a keto diet? How much goes into?
It's about an 80%, but you can do healthy fats. It doesn't have to be, they're not saturated fats
but there has been a very powerful connection between eating in general a low saturated fat diet with a lower cholesterol number. But if you're going to follow a keto diet, you should also follow your LDL cholesterol. Make sure that's not going up.
There it is. All right, keep your questions coming. Dr. Ashton on her Instagram at Dr. J. Ashton.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.